We're going to be going over some very specific things today. It's going to be stretching and mobilizing the sciatic nerve in those over 50. I don't know if anybody matches that description in here, but this is what we're going to focus on today, because how you do it in different stages of your life is different because your spine is different. That makes sense? So we're dealing with the spine, we're dealing with the sciatic nerve. The sciatic nerve is the largest nerve in your body. It starts in your lower back, comes out of your glutes, goes all the way down your leg. And so you're allowed to have some sort of discomfort anywhere from your back to the back of your leg, to the back of your calf, and even into your foot. Now, the true definition of sciatica, or issue through your sciatic nerve, is pain through that distribution, and that pain can be numbness, tingling, burning, etc., etc. It could be any of that, achiness. It doesn't really matter. You're allowed to have anywhere from the glute all the way down to the back of the leg and the calf of the foot. Anybody have those types of things? To start, my name is Dr. Michael Derry. I'm a doctor of physical therapy and a board-certified orthopedic clinical specialist, which means that I was residency trained in how to treat and mobilize the nerve and the spine and the hips, some of the most common conditions that we treat. I recognize some familiar faces, and people have heard me talk before, but today's going to be great because we're going to be doing a little bit of learning and a lot of doing. But in order to mobilize and stretch and recover from sciatica and help heal the sciatic nerve, we need to know a little bit, because it's important to know a little bit, because it's not like stretching a muscle, and you guys will absolutely feel the difference today between stretching a muscle and stretching a nerve. And some of you may already know that, but we're going to dive in to those skills to make sure you walk away today knowing the exact differences. Sound good? So there is a little bit of learning, a little bit of listening and asking questions, because the more you know, the better off you're going to be. Sound good? I love it. Okay, so I have a small concierge PT practice in this area. I live on Phillips Highway, very close. I'm in Nocatee all the time treating patients. And if you have any questions about working with me and being a part of that, you can absolutely ask them at the end. But I am a mobile concierge PT, which means I come to you, whether at your gym or your home. Okay? So we're going to be working through that. I've been treating for about 10 years now, and I love treating sciatica and sciatica-related conditions. In fact, I have a book coming out soon that is absolutely dialing into what I call my Spark program, which is the 8-week program related to helping sciatica from disc issues and stenosis. Now, in your guys' phase, and typically in the older individuals, stenosis tends to be a bigger issue than disc issues, right? So if you're like, oh, I feel like my disc is out, or I've had disc issues in the past, that can lead to stenosis. And stenosis is just a space issue, right? You're running out of space in your spine, which is causing the nerves to be poked on from arthritis. That's the main thing that's going on. Both of those conditions are space issues. You may have noticed you've lost a couple inches, or you're a little bit hunched forward because of losing space in your back. Because of that loss of space, you have sciatica-related symptoms. The nerves are being pinched on. The two classic signs related to sciatica and stenosis is, one is when you try to stand tall and arch back, you get a zinger. Whoop, down your leg. Now that can be in your glutes, your lower back, the hamstring, the calf, the foot. I had a lady just 15 minutes ago tell me she never has pain except when she lays on her back in bed. And that's because it's an extension-based exercise. Extension is arching backwards, and that's when we lose space in our back. Everybody is built with way less space going backwards than they are forwards, because bones in our back are made to protect our spinal cord. Does that make sense? Like, you guys get on board with that. We don't have as much range of motion going backwards. And when we have arthritis, whether it be mild, moderate, or severe, we lose extension first. That ability to stand tall. So when people are like, oh, my posture, I don't like my posture, I want to be able to stand taller, some of that's in your control, but some of it may not be in your control, because if you get any bit of arthritis, you lose that ability to extend. So when I work with my patients and we're trying to improve sciatica and sciatica-related symptoms, we need to improve nerve health, reduce pain, and then work back into extension. Because most people want to be able to stand taller and walk longer. Right? So the big thing is that they have pain when they extend their back. If that's any of you guys, when you go to extend and you feel it in your back and down your leg, that's a classic sign of stenosis. The other being, you love that shopping cart when you go grocery shopping. You like to lean on it and give yourself a little bit less pain and a little bit less stickiness in your back when you just lean forward even a degree. I had plenty of patients tell me, Michael, I don't know what it is. When I try to stand by myself, I can't do it, but give me that shopping cart, I can walk for days. And that's a classic sign of stenosis. And so if any of that resonates with you, you're definitely going to get something from today, because I'm going to show you exactly what you can be doing to help reduce your leg pain or back pain when you're going through those situations. And that's when dialing in, mobilizing and stretching the sciatic nerve becomes important. And how you do it in this stage in life is just different than how you would do it in your 20s and 30s. And so I want to just make sure you guys are crystal clear in that. Sound good? So the uniqueness in what I do when I want to help patients with sciatica, and one of those phases of the Spark program that I was telling you about, is mobilizing the nerve. Because it's the nerve that gives you issue. If you don't have any nerve pain, most people don't care about a little bit of back stickiness. They're like, oh, it's just normal, but I feel better after I get up and move. Like, okay, like that's fine, but it's the sciatica stuff that can get really, really aggravating. So we're gonna go over that from start to finish, and what I would do if I had a patient in front of me. Sound good? And Jan here is going to be my dummy. Jan, do you have any issues? Do you have sciatica issues?
I had 2 cysts in my back that went down my sciatic nerve.
Perfect. So we're going to be able to assess what we're going to do today is primarily one-sided. And so pick the side that bothers you more, right or left, it doesn't matter. If you're unsure, we can go over a quick test to figure it out. Is anybody unsure which side they want to do? Yeah, it's okay. We'll do a quick test to figure it out. What's that? Oh, well, then you could pick. But I like doing a little test just to make sure. So first, let's figure out the side, and then we're going to go over mobilizing the sciatic nerve in the entire pathway. I don't know if you guys can pick it up, but I love talking about this. And I'm very passionate, and you're going to be able to figure it out and have some relief today. So if you're feeling a little stiff right now, a little achy, that's perfectly fine, because we're going to help improve that. Sound good? All right, so Jan's going to be my dummy here. So everybody's in a seated position. Let's figure out what side we're going to do first. So Jan, you're going to do this with me. If you guys stay seated, you could be in the chair. It doesn't matter. We could do both positions here. Now, when you are in a long sit position, which most of you are on the floor, you're going to have both legs straight. And just think about pulling back one toe, pulling back one ankle, and then relaxing it, and then pulling back the other one. If you felt an intensity difference between your calf side to side, the one that was more intense, that's the one you want to do. That makes sense? So have the legs straight. Do you feel a difference side to side?
Oh, I already knew which leg was
okay. So you guys feel a difference? Can you appreciate a little difference? That's our first little teaser there, because that difference side to side, that's your sciatic nerve pulling, not your calf muscle, which is a big thing to know. Okay? So we're going to work the sciatic nerve, but first we're going to work its pathway, the lower back and the glutes. Right? The sciatic nerve comes out of the lower back in between the vertebrae, L4, L5, S1, and it goes down into the glutes through and around the piriformis muscle. So we're going to stretch those areas first, and then we're going to move into the nerve. You guys are excited, just as excited as I am. I love it. All right, you guys are going to lay on your back, okay? Now this is where you want to listen to my voice. Think of me right next to you. I'm going to tell you the exact instructions. So lay on your back. You can have your head supported on the mat, a pillow, it doesn't matter. Both legs will be straight. Some people like to have one leg bent because it feels better. You can do that if you need to. That's completely fine. Now raise your hand if you have any questions. Otherwise, try to listen to my voice. Now you guys just picked the side that you want to mobilize, right? Right? Yeah. Okay, perfect. Now the side that you want to mobilize, you're going to grab that knee. You're going to be at about 90 degree position here. You're going to grab with the opposite hand and pull that knee to the opposite armpit. So if it's your right knee, you're going to pull towards your left armpit. If it's your left knee, you're going to pull towards your right armpit. You should feel a stretch into your butt muscle. If you're feeling anything into your groin, you've had a hip replacement or you have hip pain, don't do that. It should be butt muscle here. You feel that, Jan? You can vary your angle, whether more to the side, more towards your neck. It doesn't matter. You just need to feel that butt stretch. You feel the butt stretch? This is where the sciatic nerve comes out. Hold for 1 to 2 seconds, then relax. Then back at it. Hold for 1 to 2 seconds, then relax. And then back at it. This is going to be a common theme. Keep going, 1 to 2 second hold, because we don't want to irritate the nerve, and that comes from the sustained hold. So if you've been sustaining a hold, this is going to be the big game changer for you, is that you don't want to sustain it. 1 to 2 second hold, then relax. 1 to 2 second hold, then relax. That pulsing sensation, guess what it does? It brings blood flow to the area, right? It gets some of that junk, that inflammatory soup out of there, and it pulls the knee, or it pulls the sciatic nerve. This is the very beginning. So we're going to do about 3 more reps there. Okay, you guys should be feeling that glute stretch. Now, if you guys are itching at doing the other side, go ahead and do it. Doesn't bother me. If you're like, Michael, I really just need to work my other side, let's do it. Feel a good stretch there? Your hip feel okay? So my typical dosage for this would be a couple sets of 10 to 12, about a 2-second hold, totally fine. You could do it every day. Mobilizing the sciatic nerve can and should be done every day if you have symptoms. You don't need to, but the research shows that if you do the other leg, you can calm down that side too. So I always have my patients do both. I'm like, even though the left or right side is feeling good, let's do both. Yeah, that's right. Mary? Yeah, so actually, thank you for bringing that up. If you put your name and email down, I am going to post this entire video and presentation on YouTube, and I'll send you the link. Okay, so you can go through the entire thing again.
But how about something more stationary, like
That will be in my book as well that I'm releasing. Yeah, this is, yeah. Yeah, so you want to pulse it, don't hold it. No 30-second holds, people. That's not what you do for a nerve. Sound good? All right, now relax from that position. Both legs will be straight. Now, whatever side you picked to do, this is what we're going to do next on that side. Now we're going to learn the difference between a muscle stretch and a nerve stretch. We need to know this feeling, okay? So, in everybody, that same leg, you're going to come up to that 90-90 position, put your knees behind, or put your hands behind your knee, right there. Support your leg in the air. It needs to be supported. Okay? Now, in that position, you're going to slowly start kicking your leg up until you feel tension in the back of your leg, and then you're going to pull your toes back. Right when you pull your toes back, that's the nerve stretch. Anybody feel a burning sensation? It's a tug that doesn't feel like muscle. Come back down. Now, when you go back down to relaxing position and pull your toes back, you're not going to feel that, because it's not the nerve, that's your calf. But when you straighten your leg, go into the restriction and pull your toes back, that's a very different feeling. Am I right, Jan?
Oh, yeah.
Very different feeling. That's your sciatic nerve. Remember, the sciatic nerve goes all the way down your leg. In the back of the knee, it splits into two different nerves, though, and this is one of them. You're going to pull it back. Feel the difference? Now, how long are we going to hold this stretch? 1 to 2 seconds. Pulse that ankle, pull it back, straighten it out. Pulse that ankle, pull it back, straighten it out. You okay? Good. You feel the difference?
Yeah.
Now, some of you may not be able to get your legs straight. That is a hamstring limitation and a nerve limitation. You have both limited there. Sound good? Now, to feel the difference with the hamstring stretch, you're going to put that strap at the end of your foot. Take one of those loops, put your foot through it. Shoes off is preferred. You're going to pull back, and then Jan here is going to pull till she feels that restriction in her hamstring. You feel that? Now, when she's in this position and pulls her toes back, she's going to be even more intense. I love seeing that face. That means she's doing it right. So if that is really intense, that means you're doing it right. Now, remember with sciatica, and they said this in the very beginning, if you do too much to irritate the nerve, you will be in discomfort. So we learn to flirt with it. So you want to go on, you want to stretch till you feel a little discomfort, maybe 2, 3, 4 out of 10 pain, and then relax, and then do it again, a 2 to 3 second hold. Stretch that nerve. Everybody feeling the difference between a muscle stretch and a nerve stretch now? Yeah, did I hear a no? What's that? Well, you may not see it, but do you feel it? Do you have that strap around your foot? Okay, so. All right, so if you're having a hard time, that's a good question. Bring your foot down so it's just off the edge of the floor. You're going to put some tension into that band. You feel that tension, Jan? You're going to maintain that tension and come up while keeping the leg completely straight. Your range of motion is going to be way less because that's the nerve limitation. Do you feel that difference? Go back down. Leg has to be insanely straight. Come back up. You feel that difference? So Jan is like, stop it, Michael. This is uncomfortable because it's a nerve stretch. Do you guys feel the difference now? Now, that's a nerve stretch. Yeah, or you go higher. Everybody feels something. That's a good question. So she asked, when do you feel the muscle stretch? So come up to that position, go to where you cannot go anymore because it's pretty intense. Slightly bend the knee. Whoop, right there. So that's when you're going to go to the hamstring stretch, and you can go way more. Do you feel the difference? So now it's going to
Different spot, right?
Yeah, so now it's going to be more in the hamstring muscle when that knee is bent. When the knee is straight, it's nerve. Does that make sense? Knee straight, nerve. knee bent muscle. Yeah, so she said muscles feel better. They do feel better, right? And so when I work with my patients with sciatica from stenosis or disc issues, we work both of these. I'll go knee straight, 1 to 2 second hold. I actually do it for you, and so I teach you how to do it and I do it for you. Jan is like, wow, Michael, I can feel a huge difference, right? And then I'll go knee bent and just go into a little bit more range of motion because she has that range of motion. So you want to do both, right? Because the nerve goes through and around the muscle and you want to tug the nerve. So what most people forget is to work on the nerve. So when you're doing your hamstring stretches, you're going to work the nerve and the muscle. And because of stenosis and other issues related to stenosis, typically laying on the ground feels pretty good to do this stretch. You can probably do it. That makes sense? Everybody feel the difference between the nerve? Go ahead, Mary. That's a great question. So dosage would be 20 reps for a 2 to 3 second hold. So let's go ahead and do that. Take your time, do your 20 reps, because I want you guys to feel better and appreciate the difference. Do you feel that? Let's move your other leg. This one's probably super loose now. So now you'll be able to feel the difference, Jan. And if you guys loosen up one side, feel free to do the other side and just appreciate how much that nerve is loosened up. Straighten this leg. Feel the difference there?
Yeah, this leg's much better.
Yeah. So when you are moving through this, work on both sides, feel that nerve stretch. Set of 20, 2 to 3 second hold. So we've worked the glute muscle. You're going to work the hamstring muscle, which comes from the knee being bent, and then you're going to be working the nerve, which comes from the knee being straight. I must reiterate, there is no trophy for more range of motion. Some people are inherently a little bit more stiff, and some people have a way more range of motion. That's just a genetic difference. More range of motion in your hips doesn't mean you're going to have less pain. Yeah.
Exactly where should it feel that we've got the nerve?
So remember, the nerve is anywhere from the lower back, glute, back of the leg, calf, or foot. Anywhere. If you're doing a hamstring stretch, you will only feel it in the back of the leg. That's where.
I do the sciatic, I feel it back.
That's the nerve. Yeah, so that's the nerve. Hamstrings do not go into your calf. The only thing in your body that is long enough to go from your back down to your foot is your sciatic nerve. That's the only thing. And skin, but you're not getting a skin stretch, guys. You're getting your nerve stretch. Now, did you guys switch sides and feel the difference? 20 reps. If you do this first thing in the morning, that's when typically people are a little bit more stiff. I promise you, you're going to feel better. Keep this strap next to your bed and just go for it. Anybody feel worse after doing it? That's what I like to hear. Good. Anybody feel looser? Feel like they're mobilizing something they haven't mobilized in a while? All right. So, 1, we've learned the difference between the hamstring and nerve stretch. 2, we've stretched the glutes because that's where the nerve comes out of, right? Now we've mobilized the knee straight. So there's 2 more nuances we're going to go over. I want you guys to move that strap to the ball of your foot, where it feels like it's almost going to fall off your foot. Because before we had it more in the arch, now we're going to go to the ball of the foot. Now remember, gather that tension before you lift your leg. Now lift up. And oh baby, feel the difference there? Now you're tensioning the nerve even more. So this is what I do with my patients as we're moving through like week 4, week 5 of the Spark program. And we're going to come up here, we're going to get a bigger stretch. Feel the difference, Jan? Now it should be a similar feeling, but it's more intense. More intense means that we're getting that nerve adapt and desensitize so it can move more and do more before you have pain. We're not removing the arthritis, we're getting the nerve used to movement. It's just the same thing as when you wake up in the morning and you put your shirt on, you can feel your shirt on your body. But then after a while, that sensation goes away because your body gets used to it and it doesn't recognize it as a threat. The same thing happens to your sciatic nerve. It's been proven time and time again. If you guys do any Googling after this, this is called neural dynamics. This whole treatment philosophy is called neural dynamics. And I go over this in more detail in my book. You feel the difference side to side? Now gather that tension. Good. Do you feel how hard I'm pulling? Do you feel that, how hard that is? I need you to match that. Now if you have loops, guys, put your hands in those loops. That's why they're there. Here, put your hand right there. Perfect. Give it a pull. There. Feel better? By better, her face is like, ugh. Okay? Go ahead, Mary.
actually physically stretch the nerve? Or
Good question.
Actually desensitizing the nerve constantly.
Yeah, so her question was, are we actually stretching the nerve because is nerve like a muscle? No, a nerve is not contractile. It doesn't slide over and contract, okay? Think of it as more of like a wet bath towel. When it's really wet and you go to wring it out, does it change in length? No, but the fluid comes out of it, and that nourishment and that fluid that we're doing is blood. We're moving some of that inflammation that happens from walking, standing, and extension. We're flushing it out through movement. That's why it feels better as you keep going. So don't think of it as like I'm actually stretching the nerve, but think of it more I am desensitizing it by removing the inflammatory soup around it. Yep. So when we actually look at it, the nerve does move with these techniques. Now, how much movement? Millimeters. But that is how sensitized your body is to nerve movement. Millimeters of movement. That's why if we lose millimeters in our spine, and when it comes to stenosis, we can have symptoms. But even though like it's not a great deal of movement, that's why when you sit and flex forward, you can have immediate relief because you're having millimeters of movement in your back, but in a lot of joints at once. Good question. Thank you for saying that. Yep. Okay, we just moved the strap down, right? We enjoyed some of that stretch, that nerve mobilization. Now you're gonna keep that strap there. You guys wanna level it up a little bit? Before we level it up, just know that if you're here and you come out away from your body, that nerve stretch is gonna go away because you're not tensioning the nerve anymore, you're stretching your adductors, the inner part of your hip. So if you move out away from yourself, foot towards the ground, away from you, it's gonna go away. You're not gonna have the nerve stretch. You're just gonna get a good stretch in your inner thigh. Do that as much as you want, it's not gonna hurt you, okay? With that said, if you don't do this yet, if you come over to the inside of your body, it is going to get intense and quick, okay? Because millimeters of movement in your back, spine, and nerves makes a difference. You feel the difference there? So I always have my patients start here. We do this till it feels good. We come down here, we tension it till it feels good. As you get better and more loose and your nerve becomes more adapt, we have to move over towards across your body. It is going to be intense, guys. So feel free to come down and then over. Once you get good there, then you go up higher and then over. Do you guys feel that difference? Like this is a game changer. So as you go out away from your body, the nerve stretch goes away. As you go across your body and across yourself, that nerve pain or stretch intensifies. How long of a hold? 2 to 3 seconds, 20 repetitions. That will loosen you up. You guys feel that difference? Across your body, across your midline, so like this. So she's coming up and across her body. So, what was that?
I said across the midline is where you feel the pain.
That or stretch. Yeah, pain or stretch, however you want to call it. Use that arm to bring yourself out there. Yeah, right there, feel it? So I always, when I work with my patients, and how do we know where to start and what stretch to start with? Well, I do an examination, right? I look at Jan, I'm like, okay, so she's good in this range, but this range she's not. And then when I come here and I add that little tension, her face is like, ah, I just met you and you're killing me, you know? And so we don't necessarily start there. Change can happen within the session, right? So as you do this, you guys probably are loosening up. But the good news is about nerve mobilizations, you can do it a lot. You can do it every day. You can do it twice a day. It's not like strengthening where you need to rest. That nerve is moving with every step we take. If I were to stand Jan up, this is walking, right? Do you see that? How one foot's in front, the other one's behind a little bit? This is walking. So if you want to improve the tolerance to walking and how long you can walk, this is it. And we can do it in a non-weight bearing position, which 99% of the time feels good in those with stenosis or back stuff related to sciatica. That makes sense? All of that kind of makes sense? Resonating with any of you guys? Make sure you do both legs because one, that leg just needs a break and you're like, I'm tired of mobilizing it. Okay, while Jan's doing this, she's going to do 20 repetitions, 2 to 3 second hold. Any questions so far? Go, Mary.
So is the stiffening from the nerves of your muscles, or is it feels like it's a muscle stiffness? It's originating because of the nerves interacting with the muscle?
Yeah, so that's a good question. So So I'll give you an example. So if I bend over, people think they're stretching their hamstrings, and that may be limited. Well, that range of motion is a combination of hips, back, knees, all of that. But most of the time it's either nerve or hamstring. So we do our assessment, and the way that we figure that out is if I spend time to mobilize the nerve and you can bend over further, which we're gonna test here in a second, then that's more of a nerve limitation, okay? If it's truly hamstring, and I don't see this very often, truly hamstring restriction without nerve restriction, I typically don't see that. But I will see both at the same time. And when people start doing both, I've had so many patients say, Michael, I haven't been able to touch my toes since I was a kid. Well, that's because most of the time you have a nerve restriction, not a muscle restriction. So you're treating the muscle as a nerve and trying to improve it as a muscle, and that's what you're missing. Yep. So, but we learn more from the examination. Is it more hamstring? Is it more nerve, etc.? Do you feel that, Jan?
I have a question.
Go.
Do you take Medicare?
Yeah. So Jan asked me if I take Medicare. Yes. Yep. Okay.
This exercise, is it more important to bring it up further, or is it more important to bring it out?
So when you're straight in line with your body, you will have more range of motion. When you come across your body, you will have less range of motion because that nerve is only so long. Okay, so I don't really care how far you do it as long as you're feeling the nerve pull. Now, to level it up even more, I have my patients come over across the body, and then I have them intentionally pull their toes back, and that's a level 10, right? You feel the difference there? Okay, that is a big stretch. This is the only time that I really start exploring that hold when you're ready for it. Guys, this is like week 8, week 10 stuff. But I just want to give you a little snapshot, and the story that you should take away is there's always a next step to keep improving the nerve mobility. Now, let me give you a real life example that I do with a patient. Let's say that you're having difficulty walking due to back pain and leg pain. You're incorporating this into your day. How often should you do it? How many reps? I would recommend doing it every day, if not twice a day. Couple sets of 15 to 20. Notice how I say 15 to 20. It's not 8 to 10. You need to get your nerve tolerant to that movement. I'll start you there for a few weeks, and then eventually at the very end of the program, we incorporate longer holds, and we hold it there for longer. And it is normal to experience numbness and tingling when you do this. Because remember that towel wringing out effect? Right, if I hold it in that wrung out position, like no fluid is going back in, and that fluid going back in is your blood, right? And so when that blood flow is not going back in, what happens? It falls asleep. That's the falling asleep sensation. So when I started going through this and really helping people dial in what a nerve stretch feels like, things started changing. And I'm not saying like your pain goes away 100%. What I'm saying, if you can get to the point of managing it and knowing what things to do to help it feel better, that's a good spot to be in because you don't have to do injections or surgery. So, does that feel good? Now have everybody stand up and go ahead and test your ability to bend over.
And I'm one of those who haven't never been able to touch their toes.
There you go, yeah. Yeah, but what you should feel is a little bit less restriction in your back and hips. Thank you, yeah. Anybody feel a difference? So what I do and what I cover in my book as well is like we start on the table, then we do some in seated, and then we do some in standing, but there are always ways and positions to mobilize the sciatic nerve. You feel okay? Do you feel worse?
No.
No? You guys appreciated the difference side to side, like what you felt different each leg. If you felt one leg was more restricted, do that leg first, but feel free to do both, right? Just doing both is good. So typically what I do is we do the nerve mobilization earlier in the session. We'll do some exercises. We'll go back to the nerve mobilization and just repeat that process. Remember, you could do this. It's a stretch. You could do it more often than strengthening. If you're that person that is like, hey, I'm fine at the grocery store as long as I sit down or I have my rollator and bend forward or using the cart, do these stretches before you go shopping. Do these stretches before you're up on your feet and standing for a while because it's going to improve the tolerance of the nerve. You're not going to be muscle sore after this or anything like that. If you overdid it, you may have a little bit extra sensitivity for that day, but then the next day it should be okay. The only time I've had people do harm to themselves, if they're that type of person, swinging from the fences, day 1, visit 1. Like you have to give your nerves some time to heal. So take your time. Every week that passes, try to go a little bit more into the range. Try to hold it maybe 1 second longer. Try to pull your toes back and go from there. Now, in the book that's coming out, there's a waiting list for that. It's going to be released soon. If you sign up for that, you'll be sent emails on that. But it goes through the 8-week progression that I would do with nerve mobilization, specific mobility work to your back, specific strengthening, and how to incorporate a walking program. And the goal is not to be on 100% pain free, which is great. But the way you know your nerve is healing is that either intensity or frequency gets better. Either your pain is less intense, but you still have it a lot. Okay, that's still kind of a win, and over time that intensity and frequency will improve. Or you're like, man, I still have it, but maybe it was at 8, but now it's a 6. And 2 weeks later, it may be a 4. And so when you combine all of those things, when I talk with my patients, I'm like, wow, you've had this for a while. The things that we really want to pay attention to is nerve intensity and frequency. How often or how intense. Both of those things are wins. Notice how I didn't say strength. I didn't say your ability to bend over more. Because nerve healing is different than everything else. So intensity and frequency. That makes sense?